Welcome back to another episode of Your Optimum Health. I'm Jeff Harrison, along with
Dr. Edmund Chein.
Dr. Chein. In our last episode, you talked about mold and really the background and the foundation of what we need to do. And really, I think more important than anything is in that episode, you brought to light and put in our consciousness of how important mold is, and then you kind of laid the groundwork for this episode. If you hadn't seen that first episode, go back and check it out. It just click back and watch this. It's about the foundation and the background of mold, and there's some information there about Lyme that I think you'll want to watch because it's critically important, and it really ties in with this episode. This episode you're going to talk about what are the symptoms of mold.
Yes.
So I'm going to turn that over to you because I know the list is surprisingly long.
So long that I have to read it off the list. I cannot memorize that. And why is symptoms important? Because that's the only way you will know whether or not your friend, you, or your relative has this problem. Because they'll tell you the symptoms that they have. And your knowledge is valuable in saying that, oh, it's not chronic fatigue. Oh, it's not Lyme, it's mold. Yeah. Okay? So I want to impart this knowledge onto the audience on this session about symptoms. Okay? Because you can't help your dear ones without knowing the symptom list, basically. Okay? Yeah. And typically, I want to make you easy to understand there are two words you have to remember. It's multi-symptom, just a headache, just a twitching, just an ache, just a weakness, just a diarrhea doesn't do it.
On its own?
On its own.
Okay.
It has to be more than 8 complaints this guy's got. And the first thing is he's crazy. See a psychiatrist. Okay? More than 8. And then the list is as long as 38. Any one of those combinations could be 18, could be 32. It's thing possible. Okay, so it's multi-symptom first of all, and then it's a multi-system. Meaning the digestive system, the neurological system, the musculoskeletal system. Each of these systems in the body are involved in a mold case. Not so in a case where everything is the nervous system, like MS, like Lou Gehrig's, and everything is a nervous system.
Gotcha.
They have no diarrhea.
It's a singular.
Lou Gehrig people have no diarrhea.
Gotcha.
You understand what I'm saying?
Right.
So it has to be multiple system. So the guy is really crazy now, okay, according to his doctors. And third is they've been to 10 or 20 doctors. Wow. Okay, they've been to Harvard, Yale, and Stanford. Okay, and Mayo. Okay, when somebody tells you that I've been to the best in the country, and all they gave me were pills, and that didn't help. Chronic fatigue syndrome pills, FDA approved pills, whatever pills they are, not helping. Think mold.
Gotcha.
Okay, because it's very hard to remember the 38 symptoms, including me. I can't memorize them.
Right.
But I will give you case. That's in the next session we're gonna have. I'm gonna give you 3 cases. Okay, and I'm gonna present one case where the patient walked in, says, "I got these symptoms," and Dr. Chein, I've been through 20 doctors, 30 doctors, nobody can help me. So we basically want to give you an example of that. Of that kind of a case, because it's just impossible to remember all that.
So in our next episode, you're actually going to present case studies that you've done.
That I saw.
Personally dealt with.
I want. I think 3 typical cases, and I'm going to present. But it's impossible to remember the symptom list. So I'm gonna go over them. We want to concentrate on the principles of not having to memorize that list, but knowing that should come up when you see multi-symptom, multi-system of the body, and having gone through 20 doctors.
Yeah.
And label chronic fatigue or label you are crazy.
I mean, does it really get to that point, Dr. Chein, where somebody goes and they say they have these issues and the doctors say that they really are what do we hypochondriac.
Hypochondriac.
And they're hypochondriac.
Yeah.
They're just crazy.
That's a great
There's
word.
really nothing there,
Yeah.
right?
Yeah,
I mean,
because
that's a clue.
every test is negative. Every single medical test, other than what I was going to mention later on, not again, if the doctors, is not educated beyond, beyond 2008 or took seminars on advancements and continuing education beyond 2008, they won't
Which
know
you
about
have.
it. Which I have.
Okay.
They won't know it. They won't know the test, and they can run all the tests in the world negative.
So they're looking for the wrong answers in the wrong place with the wrong test.
And they are justified in saying you are crazy, you got chronic fatigue, get lost, take this pill, bye.
Wow, that's sad. So there are specific then symptoms that you want to talk about. I think one of the biggest things that I'm taking away from this that I know our viewers will watch and appreciate is it's not just saying, hey, like you said, it's not just giving me a headache, or it's not just dealing with one system of our body, but it's affecting multiple systems. That could be like that first clue. I'm thinking that's what, as I'm listening, I'm like, okay, different things. So that multi-system issue, not
and we
just
put
a
in
singular-
multi-doctor. How about that? Multi-symptom, multi-system, a multi-doctor.
Wow.
Multi-doctor is a key factor too.
Doctor. That I've gone to a lot of them, and they really haven't been able to solve it. Okay, all right. They just said, hey, you're crazy, or you're chronic fatigue syndrome.
Right.
Okay.
Now let's go to that list.
Let's do it.
Okay, and by the way, before I go to the list, I want to comment on symptoms. Is that genetically, it's funny that you can have two people, husband and wife, walk into or live in a mold-infested house, or walk into a mold-infested building, and come out with two different results. One, nothing happens to them. Totally normal. Because the genetic makeup of that person is not good and bad, but I like to use the word good. It's good, okay? And the other one is bad. Comes out and immediately, within 2 minutes, can be as fast as that, develop all the symptoms that I'm going to talk about. And more than 8 of them that same night. And the other partner or friend or spouse is going to say, hey, it's nuts. How come it's not that building, it's not that home that we visited.
Because we discount that because it didn't affect us.
I didn't have it.
Ah, gotcha. Which starts that whole "I must be crazy" thing.
Yeah, exactly.
Yeah,
you are crazy. He or she won't dare saying that because it's going to start a spousal fight, or friendly fight, But hey, that's what's in the head. You are crazy. I didn't get it because you're genetically protected.
Yeah.
Okay. And the other one is genetically weak. It's not weak. It's just have. I like to use the word. Pardon me for those who are affected. It's not weak. Don't think you're weak. It's just that you are born different.
Yeah.
Okay. You have a different set of genes that
those genes are susceptible.
react to the mold toxins.
Gotcha.
You are more likely to get mold cancer. You're more likely to get cancer from mold than your dear one or your friend who walked in together with. He will never even lived in the house a thousand years. He won't get cancer.
Wow. Because of the mold.
Because of the mold and because of the gene.
Wow.
Okay.
Okay.
So I want you to know that.
Okay.
Genetic makeup. So and then here's the list. Okay. I want to go first. It's fatigue, headaches, and abdominal pain. These are the top. Why do I put on the top? Because children.
Oh.
You can have a baby 10 years old. Okay, and you're lucky, your mama is lucky because you got the good genes, your daddy's lucky, got the good genes, and the child is not lucky because the child got the recessive gene from both of you.
Okay.
It's your product, two of your product, and he or she, little boy, little girl, complain of fatigue, headaches, and abdominal pain. That's it. No other complaints. Okay, let's look at fatigue. Okay, I'm tired, mom, dad, I'm tired. Okay, you think diet, nutrition, one system, right? No. I got headache. Well, how's a headache related to diet and nutrition?
Yeah.
Okay, I got abdominal pain. How's that abdominal pain related to fatigue?
Yeah. It seems like
Boom.
2 different neighborhoods. 3
Oh,
different
you're a
neighborhoods.
child. Thing mold.
Okay.
That's all they have. The children don't have the rest of my lists.
So as a child, they only need 3 of these symptoms.
Yes.
Oh, okay.
Only 3, not eight.
Okay.
Adults, you gotta have 8.
Okay.
Children, 3.
Interesting.
So mom, dad, you got those three. Your child got those three same mold.
So it's critical as a parent to really like perk up and think, okay, 8 for an adult, 3 for my children. Now, when we say children, I mean, to what age are we thinking?
Say 13 or below.
So they've really
13,
developed pretty strong.
Yeah.
Okay. all right.
I'll say if your child is seeing a pediatrician, this applies.
Gotcha.
And your child is getting to the point where he says, I don't want to see my pediatrician. I want to see your GP. Your GP, the same guy you see. Okay, that is out of it.
All right.
You know.
So have the antennas up, and if you notice that your child is just like always tired,
Right.
They're going to bed on time, they're getting up, they're
And mom,
tired,
I have headaches
yeah,
all the time. All the time, I have headaches.
and stomach
And
aches.
I don't have it in the school. I have it at home. Or when I don't have it at home, when I go to school building, go to school and I have a headache. I come home, I don't have a headache. School building.
So it can come and go depending on the environment they're in.
Yes,
Okay.
time to talk to the school and time to get an expert to do tests on the school and then to prove. There's a whole series of legal procedures that you have to go through to prove that the school had the mold before they will admit that they have mold.
Yeah. Well, I just wanted to kind of stay in that environment just for a little bit of time, just because children are so much more susceptible to this than
Yes.
adults, and I just want to make sure that parents that are watching, or if you have, let's say you're adult, you have adult children, and they have kids, and you're noticing some of these. This is something, again, the biggest thing I know your service to the world, if you will, with this information is sharing this so that you become more educated, so that you recognize this, and it's like somebody who's never seen a stop sign before will run it because they don't know what it means.
Exactly.
These are stop signs that you need to be aware of, not to be like discomfort, or let's say be distorted over it, but just saying, hey, I'm noticing these things. They are something I need to deal with.
Yes.
Because it's more than just a headache. It's more than just fatigue. It's more than just abdominal pain. This is together,
Yes.
right? That multi-symptom.
Yes, and you
So-
take the little kid to the doctor. Both of you don't have it because your genetically makeup's good. Your child's unlucky one, got the bad genes. You take them to the pediatrician, headache, abdominal pain, over and over and over and over. After 10 pediatricians, it should hit you. Oh my God, multi-system, multi-symptom, multi-doctor.
Multi-doctor. Yeah.
Mold.
That's big. Okay, so that's the only reason I wanted to stay on a little bit longer, just because it is affecting those people who really are not making the decisions on their own. There are children.
Yeah.
Right. Okay.
And especially when the parents are not involved, got good genes, I call.
Yeah.
Hey, it's not the house. We are okay. What's wrong with you?
Yeah. Because don't we tend to try to say, when we're tracing something back, we say, well, wait a minute, it should affect all of us.
Yeah, exactly.
Or none of us. But
Exactly.
now this kind of really, again, clears that fog up and says, wait a second, it could be you have those genes that are not affected, and this person has the genes that are
Exactly.
affected.
And there are tests, there are genetic tests that I can order by LabCorp that prove that you two are okay and your child's not okay.
Wow.
And you should
Okay.
feel so bad when you find out the results of those tests.
Great.
You'll feel so guilty if you lack this knowledge or you think your child's crazy.
Gotcha. Okay, so what's next?
Okay, move on to the next. Is a group of symptoms of the 38. They're all neurological.
Okay, so let me go back to this. So the first 3 were just for the kids.
Can be adults too.
Can be adults too. But this next one now is just
Neurologic group.
Okay, good.
Neurologic
okay,
group
Gotcha.
system. Okay, and a lot of them. So the first 3, the adults can have them too,
Okay,
but typically only seen in children. They don't have the neurological part
gotcha.
in children.
Okay.
Now we move to adults. They can have for the first 3 and these neurological ones.
Gotcha,
Okay. And I'm going to read it off because I can't memorize them.
Yep.
Lightning bolt pain somewhere in the body. Light sensitivity. Tearing. Numbness somewhere in the body. Tingling somewhere in the body. A metallic taste. Vertigo. Dizzy. Just totally lay on the floor. The world's turning. Okay. Comes and goes like magic. I have a case for that. The next one is memory problems. They'll have memory problems. And inattention. They can't pay attention. Can't concentrate. confusion. These all have to do with brain confusion. Okay, difficulty assimilating new knowledge.
Oh, okay.
Go to school, gets an F. Okay, keep getting Fs. Father is a scientist, mother is a teacher. What's wrong? You know, why can't you learn new things? Or why can't I learn things? I'm a CEO of a multi-billion company. You know, how come, 2 years ago I can, now I cannot?
Gotcha.
Okay, word loss. This happens a lot of times, but it's only part of one. So if I just have a word loss, it's not, okay? But we all have word loss.
Like I had earlier, I couldn't remember what to say.
Yeah, we all have word loss
okay.
experiences, but this is a lot,
Okay.
okay? A lot. Disorientation. Never happened before, now it's happening.
Okay.
To these adults. And mood swings, okay? Again, mood swings could be menopause, andropause, but here in combination with all these other ones.
So I don't have to have all of these, just some.
And more than 8.
Gotcha.
Yes, more
Gotcha.
than 8.
Gotcha.
Okay, but these neurological symptoms, it's where the misdiagnosis comes. A lot of them were misdiagnosed as brain disorder, senile dementia, or basically psychiatric illness, bipolar.
Gotcha.
You're bipolar, giving you a bipolar pill. See it all the time, all the time. And bipolar pill doesn't do anything. Why is it not doing anything? So I want to alert people to that. One of the most commonly misdiagnosed psychiatric bipolar problems could be a mold problem.
Gosh, okay.
Okay. Now, next category, which is very, very unusual and very, very characteristic, which is what led me to the diagnosis of one of the cases that I'm going to cite. Okay. That lady went through a bunch of symptoms that we talked about. Classical standout, diarrhea. Every day, diarrhea. No doctor in the world can stop the diarrhea other than Lomotil, a drug to slow down the intestinal peristalsis chemically. I mean, I can. My doctor can control my diarrhea with Lomotil, which is a drug. It's actually the morphine-like drug, addictive kind of. But I have to take that, then I won't have diarrhea. Once I stop it, boom, the diarrhea comes back.
So it's just controlling, not curing it.
Control, not cure.
Okay.
And doctors, multi-doctor. Nobody can. GI doctor. Nobody can control the diarrhea.
Wow.
Mold. Okay?
Wow, okay.
And together with the other symptoms.
Okay.
Shortness of breath. Most commonly misdiagnosed as asthmatic attack or anxiety attack. They read it in the emergency room all the time. The shortness of breath, can't breathe. Out of the blue, nothing. And the spouse says, I'm okay. Why are you getting shortness of breath? Mold from the AC system, the spores is getting it, and they're allergic to it, and they're reacting to it.
Wow.
Okay, and they get it. Keep going to ER. You got adult asthmatic attack, and they resolve, by the way, on epinephrine and on bronchodilator, on little breathing therapy. Outlet discharge, back, outlet discharge. Each time,
Just
they,
a revolving
door,
Wow.
going in, coming out. Once a month, once a 3 months, once a 6 months, depends on how often that spore's coming down, and you're allergic to that species.
Gotcha.
That species.
Okay.
Misdiagnosed. Okay, shortness of breath all the time. The next categories are weaknesses. Weaknesses, and the most common one is a weakness of shoulder. Again, if somebody says, my left shoulder is fine, my right shoulder, click. Okay, weakness of the shoulder, not pain, just weakness. I can't move this shoulder very well. That shoulder is okay, or this shoulder is not okay. This one is okay. Boom, just like the diarrhea. Boom, it should hit you. Do you have other A symptoms? Do you have the other systems?
Yeah.
Did you go through 10 doctors about this shoulder?
Yeah.
Chiropractor, orthopedic surgeon, neurologist, and it says nothing wrong. It's my head.
Yeah.
Okay, boom, mold, okay?
Yeah.
So again, I want to make it stand out, this weakness, as to other symptoms. Then the symptom list continues. Aches, cramps, unusual pain, ice pick pain. That's a very ice pick. It's a sharp ice pick type of pain.
Yeah, okay.
They know it when they've gone through it.
Yeah.
It's hard for us to understand, but they say, yes, ice pick. That's a perfect description. That's it. Okay. Blurry vision, red eyes, sinus problems. That is again
Like sinus infections all the time, and
keep going back to the ENT doctor. You know, keep having to have sinus washing, sinus treatments, antibiotics, and no, yes, it gets the relief. Few months you're back.
Wow.
Because the mold spores get breathed into the nostrils.
Yeah.
And on top of it, these mold patients develop a condition called MARCON, M-A-R-C-O-N-S. I'll talk about it later on. It stands for multiple antibiotic resistant coagulase negative staphylococcus, a very specific bacteria created by devil for us human mankind. And it sits nowhere else. Just like the AIDS virus attacks a T cell, doesn't attack anything else. AIDS virus doesn't attack any other thing. Boom, goes to T cell. This MARCON, boom, goes to the nose.
Wow.
Only stays in the nose.
Wow.
So this ENT doctor, unless he is, trained or educated or brought up, he will never know to do a MARCON culture. And the regular labs don't even do it. Hospitals don't even do it. They don't even have this MARCON culture sensitivity test.
Wow.
But if the doctor knows about mold and this patient complains about sinus problem, well, let's just do it. You have other A symptoms? Yes, I have other A symptoms. Okay, you've been to a lot of doctors? Yes, I've been to a lot of doctors. a lot of ENT, yeah, a lot of ENT doctors couldn't cure it. Do a MARCON culture. Boom, comes back positive. Of course, you have sinus problems.
Yeah.
You got a devil living in there that need to be killed with a special combination of antibiotics called BEG. Cough, joint pains, morning sickness, skin sensitivity, excessive thirst, excessive urination, static shocks, okay, more than other people, excessive sweating, appetite swings, temperature dysregulation.
Tell me about temperature dysregulation.
Means they are like hot flushes.
Okay.
Like menopause.
Okay.
They are not menopause. They don't take the 20, 30-year-old lady, and men, they're 40-year-old, 50-year-old. I mean, men don't have hot flushes, and they have hot flushes.
Gotcha. Okay.
Extreme discomfort, and more so than the hot flushes that the menopausal people go through. I mean, just hot and cold, extreme. Sometimes even in postmenopausal hot flushes, you take the oral temperature, it's the same. It's just the feeling of coldness and hotness and sweat. But in temperature dysregulation, the thermometer actually reads different.
Oh, okay.
These are the symptoms. I mean, that's a lot.
That's a long list. In fact, if you're okay with this, what I'd like to do is allow those people watching below the video to actually, I'll have this list and they can just download it so they can say, hey, here's my list of symptoms.
And they exceeded 8.
So they can kind of go through there and check that off and say, okay, I'm at 5. I'm good.
In fact, that's how I diagnosed case. There was one case that I have. I'm going to present. That's how I diagnosed her.
Got to.
I gave her a list, and she go check.
Okay.
And more than 8. It's right on the list. And I did a visual contrast study, which I'll talk about later.
Great. So if you have not seen the first episode, we talk about the foundation, what is mold, what's the background of it, how long have we been dealing with mold, and where does it really come from, and where can it exist? Go back and watch that first video. If any of these symptoms, I don't know about you, but I was listening, I'm thinking, I feel like I'm extremely healthy. I'm one of Dr. Chen's patients, so I'm really healthy. And yet I'm thinking, okay, well, no. He said something about my shoulder. I'm like, well, no, it's not a weakness. I heard it. And so all these things. So take that list. You'll be able to download it. Take a look at it. And if it is more than 8, or if you're a child, if you have children who have those 3, do something about it immediately. Look at what we can do.
Simple tests.
Yeah. Now, if this is the first time you've been seeing Dr. Chein, and those of you who watched before, Dr. Chein, I think we had to somewhere put a tagline in there. The word cure. There's only a cure, not a control. So in this next episode, you're going to talk about 3 different case studies where you you first of all properly diagnose somebody who had already gone to multiple doctors and they already had these symptoms, and you no longer control it. You cured them.
Yes.
Cool. Well, Dr. Chein, I know it's a little longer segment because there are so many symptoms. So I want to thank you for all the time and also for joining us. This is called Your Optimum Health with Dr. Edmund Chein. I'm Jeff Harrison.
Dr. Edmund Chein.
We'll see you on the next episode where we talk about case studies in curing these issues with mold. We'll see you next time.